Good afternoon. Thanks for the acceptance of this work. The most frequent malformation of the chest wall are pectus excavatum and carinatum. In Mexico, also the previously mentioned malformations occur in approximately 1% of the general population. These are corrected mainly due to aesthetic reasons. Nevertheless, chest wall malformations are manifest in around 40% of the subjects that suffer from Marfan syndrome and similar disorders. Marfan syndrome is a hereditary disorder of the connective tissue which results from deficiency of fibrillin 1 and is characterized by displaying an irregular growth and elongation. The latter produces asymmetries and stem rotation, which becomes more evident in the accelerated growth period. It is related with pectus excavatum and can reduce life expectancy. In the Mexican case, most of the focus related to Marfan syndrome has been placed on cardiovascular disease, such as aortic or valvular alterations, whereas thoracic malformations seem to be largely ignored. In this regard, our research intends to demonstrate that treating pectus excavatum can substantially improve the cardiac functions of patients with Marfan syndrome, providing an alternate view to the treatment of the aforesaid disorder, focusing merely on cardiovascular alterations. Since 1982, the Mexican National Institute of Cardiology has treated 338 patients with Marfan syndrome. 112 subjects suffered chest wall alterations, of which 57 were pectus excavatum. 30 patients were subject to correction of pectus excavatum using the NOS technique, 2 female and 11 male patients. Patients included an age range that varied from 12 to 34 years. The Halley index varied from 4, as it can be seen in the image to the left of the screen, to severe cases with Halley index of 53, as it can be seen in the right of the screen. The average was 13.62. As this graph shows, most of the patients were adults, over 18 years old, which already had more than 5 years in control pursuing cardiopulmonary affectations. Once we average the Halley index, it is possible to see that the thoracic affectation increased simultaneously with the age. When we compare the presence of one or more cardiac symptoms, we detect that when the Halley index is greater, there are more cardiovascular affectation. 8 patients had valvular alterations, 5 precordial pain, and 2 intermittent ventricular fibrillation. 1 bar was placed in 8 patients in an average time of 60 minutes, and 2 bars in 5 patients in an average time of 95 minutes. This was our first patient subject to surgery. He is a 34-year-old patient that had a severe cardiovascular affectation, including intermittent ventricular fibrillation. Halley index was of 29.5, and they required a mitral valve replacement. As we observe in these images, our patient had no thoracic cavity. For such reason, he was excluded from the possibility of undergoing valvular replacement surgery. After the latter, we performed a NOS surgery in September 12-13, resulting in an immediate relief of the cardiac arrhythmia and with the thoracic appearance that we can appreciate at the left of the screen before and after surgery. This NOS surgery later allowed that in October 2014, the patient was successfully subject to a valvular mitral replacement by posterolateral thoracotomy approach. Results. Average bleeding was 20 milliliters. The bars have been retrieved in 5 patients after 3 years of no surgery. There have been no recurrences, and aesthetic satisfaction has been manifested in 9 patients. Complications were 1 patient with residual pneumothorax, which was solved using a probe, and 1 disparate bar that was retrieved in a patient with a Halley index above 50. The most important item is that the cardiovascular disease apparently no progress. Discussion. Pectus excavatum in patients with Marfan syndrome quickly progress, as it can be seen in the images located at the left of the screen. First, pectus excavatum with Halley index of 6. Then, 1 year afterwards, the same patient manifested a Halley index of 9. The latter shows a major displacement in only 1 year. Pectus excavatum in this group of patients is a progressive disorder that increases with age, likewise having an increased thoracic affectation resulting in a greater cardiovascular involvement. The NOS procedure in this patient is therefore more than just an aesthetic consideration. It improves cardiac symptomatology, almost immediately correcting arrhythmias, and it can potentially decrease the progression of cardiovascular illnesses. In addition, it also maintains or creates a thoracic cavity that is sufficient to develop further cardiac corrective procedures. Therefore, we are convinced that an early surgical treatment of these patients will avoid cardiovascular or skeletal complications, and we are working in a prospective study. Thank you very much.